Welcome to Wednesday's edition of COVID-19. We begin on a rather somber note as the number of daily infections, that is, here in Korea, has hit above 100 today, a reminder perhaps of the reality that the threat of COVID-19 is indeed persistent. Accordingly, global leaders have addressed the issue, including President Moon Jae-in at the UN, and he spoke of the importance of an inclusive approach to COVID-19. We have details on that later on in the program. Here first are the numbers on the pandemic with our Kwon Soa and related news with our Kim Han-ul. Now, Soa, let's begin on the local front with the exact figure and perhaps an explanation for the rise in caseload today.
Yes, Sunny. Korea reported 110 cases this Wednesday. It took over a month to go down to the double digits, but now it took just 4 days to bounce back to the triple digits. And authorities had warned of potential spikes, and those risks do remain until Chuseok and beyond.
And speaking of Chuseok, the 5-day holiday kicks off in exactly a week now. And I also hear the government's second set of relief funds will be available before that holiday.
Right, that's the plan. And now it just needs implementation after rival parties were quite speedy in coming to an agreement. So the fourth supplementary budget was passed on Tuesday, late Tuesday at the National Assembly. So relief packages will be distributed to those worst hit by the COVID-19 virus, such as small business owners and self-employed, as well as parents of younger children. And now let's take a closer look at Wednesday's figures. Again, 110 new cases. That raises the total to 23,216. The death toll remains at 388, and we have 99 people less in quarantine this Wednesday, and over 200 people have made a full recovery in the span of a day. Now, we are seeing an on-day rise by almost 50 cases here, and this figure is the same as last Saturday, which was the last time when the figure was in the 100s, and also similar to last Wednesday. In the meantime, breaking it down by region, we see that the capital has 40 cases, which means this number almost doubled compared to yesterday, followed by 30 cases in Gyeonggi province and 5 in Incheon, and also some single digits across other parts of the country. We also have 11 cases from abroad, and with that, let's take a look at the figures abroad. On the international front, we have almost 300,000 new infections reported in 24 hours and more than 6,100 new fatalities, but also almost 285,000 people have made a recovery. And let's move over to the major outbreaks across the world. The U.S., with almost 7.1 million total cases, has a death toll at around 205,000, and India has surpassed 90,000 deaths in the span of a day. And also we do see that there has been a change here. Colombia and Peru. Colombia has surpassed Peru's cases. And if we go over to some European countries, there are some concerning milestones here in the UK and in Italy down here, which have surpassed 400,000 and 300,000 cases respectively. And Bangladesh, the death toll has exceeded 5,000. And those are the figures I have for now. Usually on Wednesdays, these days we do not have a government briefing on COVID-19, which means Commissioner of the KDCA, Jung Eun-kyung, won't hold a briefing today. But what should be noted is that she was included on the Time 100 list of the world's most influential people this year, announced by the magazine this Wednesday. And she has been an example to the globe, to the entire world in fighting the pandemic. And on that note, I will toss it back to you, Sunny.
All right, so I fully agree with your remarks. And Commissioner Chung, I'll see you tomorrow.
See you tomorrow.
Right, staying on the local front, free vaccines for teenagers and pregnant women were supposed to be available yesterday, but following reports of improper storage, plans were halted. I have Kim Han-ul with me in the studio with details on that. Welcome, Han-ul.
Good afternoon.
Now let's begin with the suspension of the free vaccination, Han-ul.
Sure. So the government announced that some of the vaccines were partially mishandled and they were exposed to room temperature while they were being delivered. So the medical facilities, they decided to temporarily suspend the free vaccination program until further notice. Take a listen.
Due to the reports of improper handling of influenza vaccines during distribution, the KDCA plans to temporarily halt the free influenza vaccination program pending a quality assessment. The mishandled vaccines were part of a batch that was to be provided to children aged between 13 to 18.
Free flu shots for elementary, middle, and high school students plus pregnant women were supposed to get underway yesterday. Because the authorities found out some of the vaccines were compromised, they decided to temporarily suspend the entire free vaccination program. The government explained that infants below the age of 9 who already got their first flu shots earlier this month were not affected by this incident because those vaccines were sourced from a different supply chain.
Well, that is good to know, Hannah. So what exactly happened to the vaccines during the distribution this time around?
So the KDCA said the vaccines were partially exposed to temperatures outside the storage range. The manufacturer of these vaccines, Shinsung Pharmaceuticals, said that one of the truck drivers left the door of the refrigerated trucks open and placed the vaccines on the ground. Now, we don't exactly know how many doses were affected, but authorities are looking into the entire batch of 5 million vaccines that were scheduled for distribution on Tuesday. The KDCA has not committed to destroying all 5 million doses as of now, and they're waiting for the results of a quality test that'll come out in 2 weeks.
I see. Hannah, just out of curiosity, what happens to vaccines when they're stored outside the required temperature range?
Well, vaccines are very fragile and they're supposed to be kept cold between 2 to 8 degrees Celsius. And if not, these vaccines become practically useless. This could result in inadequate immune response in the patient and also leads to inadequate protection against the disease. As soon as vaccines are produced, they must be kept at the correct temperature right up until the moment they're used. This is why delivering vaccines through a cold chain is so important. So in order to protect your patients, you must protect your vaccine supply as well.
Meanwhile, I hear the halt in vaccination yesterday caused a bit of public confusion.
Right, so the government announced to all healthcare providers to halt the free vaccination program at the last minute, and this has caused some disruptions among people who were planning to get their free flu shots. Those who were eligible for the free vaccination program found out that the problematic vaccines only pertain to the supply that was supposed to go towards those aged between 13 to 18. But since the government suspended the entire program, some young children had to go home without getting a free flu shot. And some people have also turned skeptical following this news. According to one healthcare provider, there were patients who opted for paid influenza shots from a different source, even though they were eligible for a free one. So some of the elderly population were also concerned that there won't be enough free vaccines for them next month if these 5 million doses are discarded. From the government standpoint, losing this inventory could actually cost them up to 40 billion won or $34 million, and replacing them also takes time and resources as well.
And one final question before you go. New research shows that much like the flu, COVID-19 can be contracted multiple times. Tell us more about that.
Sure. According to the Commissioner of the Korea Disease Control and Prevention Agency, reinfection is possible. This is largely due to the fact that the virus can be easily mutated. Suspected cases of reinfection are still being studied in Korea. And back in March, Korea reported its first case of reinfection as a female Seoul resident in her 20s tested positive for the virus in March and was infected again in early April and after recovery. The commissioner highlighted another reason for reinfection, which is the short-lasting nature of COVID-19 antibodies.
All right, Hannah, thank you for that. Hope to see you again soon.
Thanks for having me.
Right, this year's celebrations of the Lunar Harvest Festival Chuseok are poised to look quite different as COVID-19 containment efforts seeks to keep commemorations this year to a safe minimum. We have details up next.
Hi, I'm Shin Se-byuk. Today I am at Incheon Family Park where over 140,000 graves and ashes are placed. During Chuseok holiday alone, over 350,000 people come to the park to pay visits to their ancestral graves. However, due to concerns over COVID-19, the Incheon city government decided to close the park this year.
조상님께 성묘를 드리고 싶어 하시는 많은 시민들이 계시는 걸로 알고 있습니다만은 코로나19의 전염력이 너무 강력하기 때문에 불가피하게 이번에는 가족공원을 폐쇄하게 되었습니다.
With the announcement, some people decided to pay visits earlier than usual. And in fact, we are seeing a lot of people at this moment, even if the Chuseok holiday has not even begun yet.
코로나 이제 첫 번째 문제고요. 두 번째는 여기 병원당 못 나온다 그래가지고 일찍 오게 됐습니다.
Well, some people are lucky enough to visit this place in person. However, some people couldn't because of the COVID-19 pandemic. So for them, the park decided to introduce a new system. And let's go and check it out what that is with me.
The park developed a program that would enable people to pay visits to their ancestral graves online. So I tried it on my own.
Anyone who signed up for the service can use this particular program, and those who live outside the country but couldn't travel to South Korea because of COVID-19 can also use this program. So once you pre-registered for this, you will be able to see this kind of screen, and this button, if you click this. So once you log into the program, you will be able to see this roadmap. And it gives you a virtual tour to the memorial park. And you see the building, this one is where your ancestors are interred. It gives you 360 degrees tour. And if you drag the screen, you'll be able to see each charnel house, and it feels like you are actually being in there. So for those who couldn't come in person or who couldn't travel to South Korea, will be able to feel like you are with your grandparents or parents or your family members. Begin the memorial service. So there are rice and stew, water, and there's flour there, so you can move in rice like this. So for me, I would like to go for a sunflower. You can also leave a memorial message to your grandparents. So for those who couldn't come to visit the memorial park in person, or for those who couldn't come to South Korea, should be able to find the program very much useful.
The park also takes a picture of the grave and send it to families upon their request.
The COVID-19 pandemic has completely changed the way we celebrate the Chuseok holiday, which indeed is disappointing. However, we need to remind ourselves of the importance of social distancing at this very moment for our own good and for our family members. So why don't we just try to take advantage of that awesome, well-established memorial services online instead? Hope you guys have a wonderful, wonderful Chuseok holiday. This has been 신새벽.
Now, do think twice before clicking on any attachments received via mobile text. According to authorities, there's been a spike in smishing scams amid the pandemic, with hackers claiming to offer essential information about government relief funds, about the pandemic, and now even about Chuseok holiday presents. Do take a look.
Korea has seen a growing number of phishing scams since the COVID-19 pandemic began. With the Chuseok holidays just around the corner, Korea's Ministry of Science and ICT, the Financial Supervisory Service, and other relevant state bodies are clamping down on voice phishing scams and other cybercrimes.
해마다 명절을 앞두고 허위 택배 배송, 허위 결제 문자, 허위 경송 당첨 문자 등을 통해서 보이스피싱 시도가 증가하고 있습니다. 코로나 시대를 맞이해가지고 보이스피싱 문자라던가 대국민 긴급 자금 지원 문자, 재난지원금 문자 이런 부분들에 속지 않도록 정확히 확인해 주셔야 되고.
Phishing is a fraudulent attempt to obtain personal information of a sensitive nature or financial data through electronic communication. One internet security firm analyzed approximately 2 billion emails sent in the first quarter of 2020 and discovered 36% more phishing emails compared to last year. According to a government survey, the number of reported smishing incidents from the beginning of this year to August jumped nearly 5-fold compared to a year earlier. The majority of recent phishing and smishing schemes were aimed at profiting from the COVID-19 pandemic.
After COVID-19, the hackers also spend more time on computers. At the same time, users spend more time on computers and smartphones. As a result, hackers find individuals much easier and have more time to hack into individual smartphones.
The situation is no better overseas. A growing number of scammers across the world are also capitalizing on COVID-19 to target unsuspecting victims. In early August, the United Nations announced that the number of phishing websites on cyberspace had jumped more than 4-fold in the first quarter of 2020. At around the same time, Interpol also publicized a report warning of the recent surge in cyber threats. Experts say the rising number of cyber crimes may be associated with the growing use of computers amid the global lockdowns and social distancing measures.
Generally speaking, we don't have the same level of cybersecurity protection at home as we do at the office. There are exceptions, but we're now dealing with, so many more people that have been forced to work from home, perhaps in an unsafe environment or less safe than at the office, where there might be all kinds of cybersecurity, software and protocols in place to protect the employees from hackers and scammers and things like that.
The Korean government has responded to these threats by creating a special anti-smishing task force, as well as a comprehensive plan to eradicate voice phishing. It is also important for individuals themselves to raise their own awareness of phishing scams to avoid falling into one of its traps.
코로나 사태가 장기화되고 추석이 다가오면서 택배 서비스 이용이 증가함에 따라 택배 사칭 문자도 꾸준히 발견되고 있어 주의가 요구됩니다. 스미싱의 경우 문자 안에 인터넷 주소를 클릭하더라도 악성 앱을 설치하지 않으시면 피해를 예방할 수 있습니다. 웹브라우저 상단의 인터넷 주소가 정확한지 반드시 확인하시고 이름, 전화번호, 스마트폰으로 전송된 인증번호 등을 입력하지 않으시는 것이 좋습니다.
Amid the growing number of phishing scams, government authorities and citizens alike must remain vigilant against scammers looking to exploit people's fears and anxieties over COVID-19.
코로나 2차, 3차 대유행의 우려가 여전한 만큼 한국은 K-방역의 경험을 국제사회와 적극적으로 공유하고 지속적으로 함께 하겠습니다.
We will distribute a vaccine. We will defeat the virus. We will end the pandemic.
面对疫情，我们要制定全面和常态化防控措施。
The general debate of the UN General Assembly, the most high-profile event of the Assembly itself, saw world leaders making their speeches online as the pandemic keeps them from traveling and from gathering. President Moon Jae-in's pre-recorded address was live-streamed early this morning. For more on his words and those of his global counterparts, I have Director Kim Moon-gyu of the ODA Center at the Yonsei Institute for Global Health. Welcome back, Director Kim.
Thank you for having me here.
And I also have Professor Park Won-gon from Handong Global University. Good to see you again, Professor Park.
All right, thank you for having me again.
Professor Park, this particular UN event is probably the first multilateral forum of global leaders in the midst of the pandemic, and some claim it comes at a crucial time given the nationalistic tendencies brought on by COVID-19. Do you share this belief?
Well, I think it should be a very important meeting, especially it is very good opportunity to gather the leaders in all over the world, including some of the influential countries like the United States, China, and of course the South Korea too. But because of the pandemic, you just mentioned that it's like a virtual meeting rather than the in-person meeting. And at the same time, you know that there are intensifying the rivalry between the United States and China. And the two superpowers are supposed to cooperate with this kind of very serious disease, but we all know that they just pursuing their own national interest. And also, because of this United States accusation of WHO, World Health Organization, they consider the WHO is a pro-Chinese kind of mechanism. So the United Nations itself is a very important multilateral institution, but they are losing kind of power to bring cooperation among the countries. So I think it's going to be a very important meeting, but we can easily expect that it's going to be less important than before, especially the President Trump himself. He's a very kind of a negative view of the multilateral institution, including the United Nations too.
Right, and we'll take a look at that later on during our discussion. Director Kim, the theme of this year's assembly is COVID-19 response. Now, it's been exactly about, 6 months since the WHO acknowledged the outbreak as a pandemic. How do you assess international efforts against COVID-19 so far?
Well, I would say that the WHO, the existence of WHO itself is a good thing, that they are in the front of all this thing, monitoring the things happening, and actually, they announced very early reports, alarming reports about this COVID-19, as they did for SARS and MERS. And domestically, since we get information from WHO, our physicians, Korean physicians, were very rapid in building the diagnostic system. So I would appreciate the efforts of the clinical laboratory medicine doctors and professionals. The shortcomings are, the virus was far more fast than we expected. So since we were prepared, still we have some cluster outbreaks. And we prepared some masks and personal protective equipment, but it was short. So soon we got out of it. So we say they were not that ready for this kind of things. And some people claim about some transparency issues. So I think we have to rebuild the trust between the international organizations.
I see. Professor Park, President Moon Jae-in's speech, meanwhile, also touched upon Korea's COVID-19 response, and he put emphasis on the active participation of the public to ensure containment. Essentially, what aspects of Korea's response to COVID-19 has garnered global attention in your view?
Well, I think President Moon Jae-in explained well how South Korea has dealt with the coronavirus. Of course, we are saying that it's the middle of the coronavirus, and President Moon Jae-in himself said that we have chance to have a second or third wave of the coronavirus. But so far, it is true that Korea is one of the safety places, and which means that we are very effectively deal with this coronavirus compared to the other countries, like the most of the advanced countries, including the United States and some of the European countries. And so in that sense, President Moon Jae-in emphasized 3 principles, and which is very interesting. And he said that openness, transparency, and democracy. And those 3 principles that South Korea has used to deal with the coronavirus, and pretty much successful. Right now, it is a very contentious issue. Which countries deal with this coronavirus more effectively? I mean, China, they just proclaimed victory of coronavirus, and they are getting started to open their country to the outside world. But China is one-man rule and one-party country, which is a very authoritarian regime. On the other hand, the United States is the leading country of the so-called liberal democracy, but they have a really hard time. So always the United States, especially President Trump, when he mentioning about the importance of a liberal value, he is making example of the South Korea as one of the liberal countries to deal with the coronavirus very effectively. Of course, he's talking about Taiwan too. So right now we have some kind of debate which regimes is more effective than. So in that sense, I think President Moon Jae-in's point a very important point that South Korea is a liberal democratic country, but also we respect those principles, but at the same time, we deal with this coronavirus very effectively. So that's his main message.
Right. Director Kim, you've also been seeking actively to share Korea's strategy against the pandemic with your counterparts across the globe. Please tell us a bit about your campaign as well.
Well, yes, we started to share our knowledge of COVID-19 with some underdeveloped countries with cooperation with KOICA. And we posted our motion pictures in YouTube and even with other internet services. And the response was twice than we expected. And we had hundreds of questions asking for how to deal with the COVID-19. And we had replied one by one of those questions. And since we had a good result, we started the next step of our job, contacting some Southern Asian countries, and now we are having a web-based conference. So we invite our professionals, and as a real time, all the doctors in the Southern Asian countries were invited, and they ask questions. We share our experience. I think the same kind of model will be applied for other Central Asian countries and Northern Asia. So I understand they are keen to understand, to learn our experience from us. And I think it's also an opportunity that Korean doctors are learning about those underdeveloped countries' situation, and we're trying to find out what we can do for them.
I see.
Yeah.
Well, now for more on the importance of a collective response to common challenges, we spoke earlier with Cho Hyun, the permanent representative of Korea to the United Nations. Ambassador Cho echoed the words of President Moon Jae-in, placing emphasis on the importance of a multilateral approach to COVID-19, which is also being championed by the United Nations. Do take a listen.
Indeed, COVID-19 has brought about a dramatic change at the United Nations. The UN was completely closed down from March on, and UN officials, secretariat people, even they were unable to get into their office at the building. However, the UN has adjusted and moved on. We were able to organize many virtual meetings, and we agreed upon how we can adopt resolutions. As for Korea's role at the United Nations, from the very beginning, we were able to share our know-how in dealing with the COVID-19 very well at an early stage. And we also arranged delivery of testing kits and facial masks to many developing countries through the United Nations. The international community must focus on the pressing issue at hand, that is COVID-19 crisis. But I believe the UN should also deal with more important issues eventually, that is climate change and peace and security of the world. The world must work together to overcome these serious challenges through the United Nations. As for Korea, there are high expectations for Korea to play the role, not least because Korea has been very successful in dealing with the COVID-19 crisis at the initial stage. More importantly, Korea is a vibrant democracy and high-tech industrial economy. Furthermore, Korea has a culture that can connect with the young generation of the world through K-pop, such as BTS, and movies like Parasite. Therefore, we can contribute to the international community by sharing our ideas and know-hows and economic assistance to many developing countries through the United Nations. Thank you.
Right, those words were by the Ambassador Cho, that is, to the United Nations. Professor Park, let's touch upon details of President Moon Jae-in's address to the UN, which also underscored the importance of, quote, strengthening inclusiveness in international cooperation. Please tell us a bit about the gist of his message.
Well, I think inclusive is a very important word. Right now, the United Nations, they have a so-called Sustainable Development Goal, SDGs, and most important feature of the SDG is inclusive. They are saying that no one left behind, so that's their slogan. So in this pandemic era, and South Korea has put the emphasis on the inclusive, which means South Korea is willing to help the other countries. And although we have our own difficulties, still we have a huge issue about this pandemic, but we are going to try our best to help the other countries. And the Ambassador Cho just mentioned that South Korea is shared our experience to the other countries, and simply we are ready to already help the other countries through the United Nations. So that's why I think President Moon Jae-in emphasizes inclusive. And the other reason I just mentioned that because of the growing intensified kind of rivalry between United States and China is trying to exclude with each other. They are saying that every country that put the pressure which side they are going to take. That's not inclusive at all. So when you hear the President Moon Jae-in's speech, and I think most half of this speech is about the multilateralism and inclusive and those kind of international principles. He put lots of emphasis on those kind of very liberal values. I think it's very appropriate.
Right. Director Kim, there was also a reiteration by the President for equal and fair access to vaccines. Now, I suppose international collaboration is essential to ensure equitable access to vaccines for countries around the world. Would you agree?
Yes, definitely. But first of all, I would like to remind something, what happened in our history during World War II. United States and England had a drug called penicillin, and Germany, they didn't had it. I mean, they were not interested in that kind of drug. They had that information, but they didn't know that that drug was so effective. And actually, if you use that antibiotics when a patient got infected, the result is totally different. So right now, we are not at war. So if you have information of COVID-19 and this country does not have it, there's no reason that we should not share. So I definitely agree with that. And already, WHO has a global vaccine action plan, 2020. And still, we are not reaching a good result. Only 86% of children are properly vaccinated. So without regarding about COVID-19, there are still many issues about the vaccination. And when we start to speak about COVID-19, there is a precondition. Is this vaccine safe and is this efficient? So that's the precondition that we can start to talk with. WHO insists that they're going to distribute the vaccine according to the population of the country. So they start with 3% and gradually they're going to increase to 20%. But personally, I don't agree with that strategy because the situation from countries are different, so different. So the scholars are starting to talk about the fair priority model, which is recently published on the Science article. There's a central decision-making factor, which is ethics. And there are three key values of this strategy: benefit people, limit the harm, and the second one is prioritizing the disadvantaged, and the third one is based on the equal moral concern. So with those three values, the first step is to reduce the premature death. According to our data in South Korea, the mortality rate is about 20% if your age is more than 80. So definitely, if you're more old, you are at risk. So generally speaking, people say that if you are more than 65 years of age, you mean you belong to the risk group. So that's the first step we should target. And the second step, reduce a serious economic and social deprivation, such as business and school. The children cannot have a proper education during this time, so that will be the second step. And the final step is to returning the full functioning society. And I think President Moon was talking about this issue.
Right, he was. Professor Park, UN Secretary General Antonio Guterres has been calling on the world's richest countries to help their poorest counterparts. He's seeking $10.3 billion in relief funds for impoverished countries amid the pandemic. And so far, only a quarter of that amount has been collected. What reason is behind the lackluster support?
Well, I already mentioned that it's very difficult to getting some kind of a cooperation among the countries, because the first reason is the growing rivalry between the United States and China. And United States President Trump, in his United Nations speech, he also one more time blamed China, and he called China virus. And it is well-known fact that President Trump decided to withdraw from the World Health Organization. And so that means, as Dr. Kim mentioned, that need of the budget to help the other people, especially underdeveloped and developing countries. But United States is the biggest sponsor of the World Health Organization. But if they finally decide to withdraw from this WHO, we are pretty sure that a lack of fund to develop and distribute the vaccines. So far it's understandable about lack, because, and another reason is that every country, they just pursue their own national interest, which means that there is kind of competition who's going to get the vaccine first. If they cooperate, I mean, still United States and China, two great powers, they cooperate each other, we can get the vaccine more rapidly and also equally distributed to the world. But because they're very soaring relationship is very difficult, and also difficult to get and to raise this fund for the world.
Mm-hmm. Director Kim, some believe that the lack of support for international organizations is also because of their inadequate responses to the pandemic. What are your thoughts on this?
Well, international organizations have to work by the fund, the money they have, the budget they have. And as Professor Park mentioned, the two big economic powers are in tension right now. So it results in the disrupt of coordination. But as I'm a doctor, I would like to put politics and health issue in a different vessel. And personally, I think there are two good examples of that COVID-19 strategy, which country is Taiwan and Sweden. They have a totally different direction of strategy. But one thing common is that they let the medical professionals to decide what to do and what not to do. And I'm keen to look at how it's going to work out. But including Korea, most of the countries, the politics intervenes, and sometimes that policy might be inaccurate or improper, not proper. So I hope that from now, all the international organizations come together and decide which one is the best policy for right now. And I think that's something, it's very urgent because the autumn is coming, and we don't know what's going to happen during the winter time.
Right, indeed. Professor Park, as you mentioned, US President Donald Trump urged the UN to hold China accountable for the global spread of COVID-19. He also found fault with the WHO, claiming that it is virtually controlled by China and that together they had falsely claimed that human-to-human transmission of the virus is impossible. This is, of course, earlier on. What do you think is the purpose of such a hardline rhetoric on the global stage by the US leader?
Yeah, I think there are a couple of reasons that President Trump blame and criticize China. First, because of his re-election this coming November 3rd, and it's going to be about the American presidential election. And right now, the American public themselves has pretty much negative view of the Chinese people, because it is allegedly known that China has at least cover of a month to recognize this very serious novel virus. So that's why many the Americans, also some of the Westerners, and they are very upset about Chinese government not to disclose this kind of very serious disease to the world as soon as possible. So I think President Trump definitely wanted to use this kind of public sentiment against China. So that's why he's very hard on China. And also in the broader picture, it's kind of a hegemonic competition between China and United States. So not only President Trump also, but the candidate Biden, the former vice president and Democratic candidate, he also has a very hard, strong policy against China too. So no matter who's going to be next president of the United States, it's going to be continued to have this kind of harsh policy against China.
He made no mention of North Korea this time around.
Oh,
How do you respond to that?
Well, it's interesting, President Trump, he's really wanted to talk a lot, but this is a 15 minutes record, and he just spent 7 minutes. And there are also a couple of reasons. First, he doesn't like the United Nations. And 4 consecutive years, and he made a presence on the United Nations General Assembly and made a speech, but every time he criticized United Nations, and he does not believe in multilateralism. And this time he also reiterated this kind of argument that the United States will put their national interest first, so other countries. Though these kind of totally deny the existence of the United Nations. So that's why he does not mention about one of the reasons that. And another reason, North Korea, he could not say anything about North Korea at this moment because most of his speech is about the achievement, about his policy, especially the diplomatic field. He was talking about his recent normalization of the relationship between Israel and United Arab Emirates and Bahrain. And so about North Korea, he doesn't say anything to achieve anything about the Korean Peninsula peace process. So that's why he did not mention about North Korea.
Right. Director Kim, earlier on you talked about the importance of international entities like the United Nations seeking to rebuild trust of the people to ensure a collective response to global challenges. In what ways can we ensure such trust? What are some of the essential tasks at hand?
Well, if I say we passed only halfway or even less of this pandemic, we might have not seen the worst yet. I do hope that that kind of thing might not happen, but it's time that the global community moves toward on the basis of ethics and prioritize the risk group and countries that have a higher transmission rate. I don't want to make people afraid of COVID-19. Since I told you that the mortality rate is very high in elderly, Korea does not have a single mortality if you're younger than 30. That means the younger people are quite strong against this COVID-19. And I don't know economics, but I can feel that our country is badly affected by COVID-19 according to the economics and other parts of the society. So I hope that we can make consensus about this subject and go further and prepare for the next thing.
Right. One final question then, Professor Park. President Moon Jae-in talked about the importance of regional efforts to overcome global issues. With that in mind, what are your prospects for the UN General Assembly this year around?
Yeah, he did suggest the so-called Northeast Asia Cooperative Initiative for Infectious Disease Control and Public Health, and it includes South Korea, China, Japan, Mongolia, and North Korea. I think it is, if realized, it definitely is a very effective the kind of mechanism to deal with coronavirus, especially in the Northeast Asia. And also, it is true that North Korea is refused any kind of help from the outside world, including South Korea. But at the same time, North Korea has denied any one confirmed case of coronavirus. But many the other agencies and many government, including South Korea government, we are pretty sure that there's going to be some kind of a confirmed cases already spread. I don't know how the exact numbers of the confirmed case, but definitely they are suffering by this coronavirus too. So for that purpose, it is inevitable, kind of important to get to have some cooperation to deal with this issue among the countries in the Northeast Asia. So that's why President Moon Jae-in suggested this kind of initiative.
Right, a joint, transparent effort to fight the pandemic then. All right, Professor Park, as always, thank you for your thoughts. And Director Kim, thank you for being with us today. Right, well, that is all the time we have for today's edition. On Thursday, we revisit the topic of vaccines, and this time with the focus on their safety. Do join us again tomorrow at this hour. In the meantime, do take care, and thank you for being with us.